And good afternoon. It is November 14th, 2023. I'm Dr. Deuk, CEO and founder of Deuk Spine Institute. We are broadcasting live spine surgery. Our patient travels here from Sebring, Florida, where the racetrack is. And he has back pain in this area, right where the L4-5, L5-S1 discs are. He may also have some facet pain, but we talked about that. We're going to start by fixing the discs that we know are a problem. Shot? Now, the two discs we're after are the L4-5 and L5-S1. On his MRI, you can see he has, shot? The discs are damaged. I could feel the facet joint. Let's do a little more num-num.
Keep your hand still, my friend. Keep your hand still. You're doing great. Narrow bed. Nice and still for me.
The first step of the surgery is to gain access to the discs that we're fixing. And that's done using a needle, spinal needle it's called, because we're going to the spine. Once the disc is accessed with the needle, we're going to bring a guide wire. Shot? You can see the arthritis in the facet joint there, how significant it is. Shot? We call that sclerosis. When someone has a lot of arthritis and it causes the bone to get thick, we call it sclerosis. Shot? All right. Our patient is shot. Awake for the beginning of the surgery. I may have to change my trajectory. I may have to come from a little bit higher up. Shot? Yeah, I think I do. I'm going to have to come from a little bit higher. Is that, oh. Shot? That's better. Shot? We've been giving him a lot of numbing medicine because he has some bad sleep apnea, correct, doctor? Shot? And patients with sleep apnea, well, they don't tolerate anesthesia very well. Shot? So we can't put him too deep asleep. Otherwise, he could stop breathing. Shot? Looking good. Very good. I feel the herniation. Give me an AP. I'm going to put a little pressure. Was he on a blood thinner at one point? Yeah, I can tell. Yeah. Lateral. Very good. I'm going to put some more numbing medicine. Yeah, that's fine. And that's where we are there? Yes, sir. All right, perfect. Shot. Excellent. Shot. All right, I feel the back of the disc where the herniation is. That's one. Going to make an incision. And we're going to go for the next disc, which is L4-5. Any questions from our audience?
No questions.
Let's show our video on how do these disc injuries cause so much back pain. Can you do that, Sanjay? All right, welcome back. Can you hear me okay?
Yes.
So our patient, when I asked him, where is your back pain, you know, he basically showed me this area here. And he has two discs in here, the L4-S1 and the L4-5. Okay. And how long has he had back pain for?
At least 12, but the last 3 were the worst back will do.
12 years. So lower back pain greater than 12 years. And it's right in here, in this area where the two discs are. Okay. Are you awake?
How are you doing, my friend? He says he's all right.
He's talking to us.
Talking.
And he's from Sebring, where the race cars are. No problem. So, you ready? How bad is that on a scale of 1 to 10?
Give us a number.
How high does that go?
An 8?
What's the highest it goes? 9. Is that where you get your back pain?
Is that where you get it? Yes or no?
Yes.
He said yes.
So he's got 9/10 concordant pain at L5-S1 disc. That means the disc at L5-S1 is causing his back pain. All right. Almost done, my friend. We're going to put you to sleep in a minute. So far, we've lost about 20 drops of blood or 1 cc. How bad is that on a scale of 1 to 10? Huh? 10? Is that where you get your pain?
Is that where you get your pain? Yes.
Yeah.
Yes.
All right. No problem. So 10 out of 10 at 4-5 concordant. So we're ready to move forward. I'm going to wait for Dr. Berndes. He's going to take it nice and slow. We're going to use lots of numbing medicine so that he has to use less of his anesthetic. You're doing great. Just lay still. And you could see the tears that he has in his disc. Now, people ask me, can this surgery fix degenerative disc disease? Yes, it can. Is it going to get rid of the degenerative disc disease and the disc is going to look normal? No. That's not what we're trying to do. You don't need to make your disc look normal to get rid of pain. Lots of people have bad looking discs but zero pain. That's what our goal is. Now he is 86? 87 years old. 87 years old, folks. It's never too late to fix your back and enjoy life.
Very nice gentleman.
Yeah, he's a gentleman for sure. And he lives just a few hours away from where we are. He lives in Sebring, Florida. Shot? All right. As I advance the dilator to the disc, I'll be giving him some more numbing medicine. Just shot. Uh-huh. How comfortable are you with giving more numbing medicine? Considering there's not as much propofol, it's still okay?
Yeah. He's on an infusion based on.
All right. Great. At this point, we are just outside the disc, entering the foramen. You guys see that?
Yes, we do.
Our dilator is coming in low. It's coming in just underneath the exiting nerve root, medial to it. At this point, I'm going to advance the dilator through the annular tear.
You know, in this case, the local anesthetic is better for vital sign control.
Good. Now, I just want to mention our last patient, Shot. She's doing fantastic, the cervical. I saw her. She's feeling very good. She's wide awake.
Very nice patient.
She's from Minnesota. She's still waking up when I saw her, but she's probably going to be able to get out of here in about 30 minutes.
She has some family in Florida, not too far away.
Mm-hmm. Yeah, her brother is close by. Perfect. Okay. We are ready. Looks good. We're inside the L4-5 disc. We're going to repair it with the laser. How is he doing?
Doing well. Keeping a very close eye on it. See it?
I think this is it. Here.
As I do with everything.
Of course.
What is it?
All right, there it is. You can actually see some of the granulation tissue right next to the herniation. Y'all see that? Sanjay? The pink tissue?
Yeah, yes, we do.
The pink tissue is the cause of the pain, folks. And people ask me, can you fix a degenerate disc? Can you fix the pain? The answer is yes, because we're still getting rid of the pink tissue, the granulation tissue. It's the same reason in everybody's disc. Doesn't matter how degenerated the disc is. It's always the inflammatory tissue that causes the pain. Again, a discovery made at Deuk Spine Institute by myself. That is the cause of back pain, folks. Look how damaged the disc is. Look at that piece right there. That is not supposed to be brown. It's supposed to be white. That just shows you how old the herniation is here. It's super old. Years. And that orange color, folks, anybody want to guess what that is? All right, I'll tell you what it is. You see it in other parts of the body from time to time. You can see it in the legs, in the skin. Anybody know what it is? Patients with venous stasis disease. What do they get? I'll open this up. You get hemorrhaging, bleeding into their skin. This is bleeding into the disc. It's called hemosiderin. Hemosiderin is basically deposition of heme and iron within the body's tissues. Comes from hemorrhaging. So why would there be hemorrhaging in his disc? The answer is the inflammatory tissue, right? It has granulation tissue, which is little blood vessels that are very easy to hemorrhage. Wow, what a beautiful view with our scope. For reference, the scope, the fiber you're looking at is a 1 millimeter fiber. That means the glass part is 1 millimeter across. Luis, what did you find out on the fibers?
Oh. No, they're actually legit.
Huh?
I asked for one
They're
sample.
what?
They're actually legit.
Legit.
They're good. Yeah, they're good. They're good.
So we can get a 1 millimeter for that price?
Oh yeah, 1 millimeter and then the 550 as well. I asked for a sample. So I'm waiting for them to send me a sample.
And it won't ruin our laser.
No.
Can you bring the pedal closer to me, please?
Closer to me.
I need it like right here. Thanks. Thank you. Yeah. And now the laser's coming from Phoenix. I know that
Couple weeks.
he doesn't have this foot pedal right here.
Yeah, he's gonna find
He's
one.
gonna get them
Yes,
for us
Yes.
and send them separate, which is fine.
Yeah.
I trust him.
It's nice.
Yeah. But we need to get more of them. Woo, look at that herniation. Look at this thing. Can you see it, Sanjay? It just came out. Just look at the size of this thing.
Yes, Dr. Deuk.
Put it there.
Just a minute.
Huh?
I'm just gonna point it out.
Can you see it?
Yes, we can.
That is a giant herniation. And there's evidence of hemorrhaging in there. Okay?
Yes, we can see that.
Pretty cool, huh? Poor man. No wonder why he's been in so much pain. I'm going to keep taking more pieces out. Any questions?
No questions.
You are streaming.
Yes.
You verified?
Yes.
All right. Well, then let's show the audience why do these annular tears and herniations cause so much pain. Or, sorry, we already showed that, but let's show them how the Deuk laser does it. Okay, welcome back. Now you can see just how the surgery works, the Deuk laser disc repair. We're cleaning the tear. It's called a debridement. In medicine, we call it debridement, okay? We're not the first in the world to do debridement. Debridement has been around for a long time. Well, we're the first in the world to do an annular debridement, a debridement of the annular tear. Here's some more granulation tissue. Inflammatory tissue, there's a piece of herniation. Any questions from our audience?
We have a question from CV Way on YouTube.
Okay,
Hi doc,
hi there.
I had my treatment sometime this year, rhizotomy and epidural, but
Okay.
nothing has changed. MRI shows nothing wrong with my disc, no pinched nerves whatsoever, but shows arthritis on facet bones.
Well, here's my advice to you. Tell me the name again.
CV Way.
Okay, my advice is you get your MRI uploaded and do the free Deuk Spine Institute MRI review. I will meet with you. I'll tell you exactly why you have pain. Okay? I need to see your MRI pictures, the report, and I need to see you through Zoom. So we can arrange that for you. Go ahead and put the link. He's doing great, by the way. He's not moving at all for me. Well, you can. Oh, really? In right now, you mean, or before?
What's that?
You mean before?
When you went in initially.
I mean, okay.
So he dropped down to like 48, 47. I was all over the thing like that. But pressure's a little low.
Yeah, well, he may.
He didn't do well with that first one. So let's hopefully I can give him something before you do the second one and see what else.
You don't think it was a local, right?
No. People get, I've seen this, people get a little vasovagal when you first enter in there. I don't know what it is, but it usually elderly people.
That's fascinating.
Yeah, it's happened. This is not the first time.
Well, it'd be nice if we can.
So it happens so commonly that sometimes I give a little squeeze of ephedrine right before you go in.
Yeah, and that takes care of it.
It fixes it right away. But I held off on the ephedrine because of the stents. To work on the gym.
Oh, right.
Stent patients.
Right. Okay, so Dr. Berndes and I were just chatting about the patient's condition as we're finishing up this first disc. There, you guys see the inflammatory tissue?
Yes, we do.
Right there. It's beautiful. That is where all the pain comes from. It was first described at Deuk Spine Institute. Now, the first person to describe inflammatory tissue in these damaged discs was a Swedish neuroanatomist who I don't think is alive anymore. But the first to point out that it's that causes the actual back pain was us at Deuk Spine Institute. We're the first in the world to identify that the inflammatory tissue found inside these annular tears is the actual cause of chronic back pain in basically 85% of patients with chronic back pain. All right, so if you have pain and you want to know where it's coming from, all you have to do is use our free MRI review. Submit your MRI. I can guarantee you the discs are not normal without even looking at your MRI. I can tell you the radiologists miss the abnormalities all the time. And unfortunately, as a result of that, people suffer with pain, believing that they have nothing wrong. But you actually do. And it's totally fixable with this surgery. 85% of the time. Any more questions? Just about done. And we have one more to go.
We have a question from Premier Media Group.
Hello, Premier Media Group.
Dr. Deuk,
Yeah.
what was the reaction of fellow surgeons, lawyers, insurance providers, and patients when you started live streaming your surgeries?
What was the reaction? There was no reaction. Great question. I think the public was happy to be able to watch these surgeries live, but we never got a reaction. You know, we never polled anybody, heard anything. The only thing we've ever heard is people happy that we're live streaming, you know? Pretty much, huh?
May our patients appreciate that.
Yeah, people appreciate the time to sit here and watch. By the way, this is the same process that occurs in residencies all around the world where surgeons are trained. They're trained exactly as I'm training you. Actually, what I'm doing for you is better than what they get because they have to stand where Luis is and they really can't see what's going on. But because we use a special camera where it's located and because we have the endoscope, you guys get to see a better view than actually the surgeons that are learning how to do surgery in their respective training programs, okay?
In the old days, the hospitals, the operating rooms were not called operating rooms, they were called theaters. And the reason they were called theaters is because right on top of where the surgeon was operating on the patient,
Yeah.
was a glass dome or a molded type of glass
Yeah.
where the residents and trained younger physicians could watch
Yeah.
the surgery.
Dr. Berndes made a great point. He said in the old days, the operating room was called the operating theater. Hold this.
Yeah, right, the operating theater, right.
The camera. Because if you look up above you in the old days, there was a glass window and there were actually people watching the surgeon do surgery.
There was a show called
Through-
Nick on Netflix that had a couple of episodes regarding the theater where
Yeah.
the residents were watching this.
They don't do that anymore, obviously, but I actually saw that when I went to Johns Hopkins.
Oh, yeah, they still have that on.
Yeah, at Hopkins. Yeah. They show us the operating room with the glass ceiling. I don't know if they still had it, but this was back in '97 when I was interviewing at Johns Hopkins.
I hope they still have it for posterity.
Yeah, they ought to keep at least one, right? So, you know, I think I've never had lawyers complain about it. The insurance company doesn't complain. I think maybe if I was a really bad surgeon, always making mistakes in the operating room, they probably wouldn't want me to show it. But we've not really had any complaints about it. Great question. Great to hear from you again. Just about done. Just take a look at this bone spur here. I'm going to show you guys the bone spur. See this bone spur? See how it's nowhere near the nerves? You can't tell that unless you get in here and you see it. Okay? It's really not doing anything. I'm going to shave it down anyway, just to show you how the laser can shave it down. But, you know, people ask me all the time about bone spur, bone spur, bone spur. You know, the bone spurs are what your surgeon tells you just so they can operate on you. Because most people think, oh, a herniation is going to go away on its own, but a bone spur won't. So the surgeons will tell you got bone spurs just to get you to agree to do their surgery that they want to do on you. But in reality, you don't need the surgery that they want to do. And the bone spurs aren't doing anything to hurt you. But I figured I'd just show you guys so you could see. All right, we're pretty much done here. I'll show you the nerve. The nerve is going to be right up here. There's the nerve in that fat. It's kind of hard to see, but it's down there. But it's protected. We're done here. And this was the 4-5. We still have the 5-1 to fix. We'll do the same thing at L4-S1. Yeah. Got some secretions? Any more questions?
No questions.
Where our viewers know everything today.
Looks like.
All right, one down, one more to go. Now this patient, not only is he 86, but he's had stents put in. And that was a couple of years ago, right? So the stents have kind of done their thing, healed. And he was cleared by his cardiologist.
He has a normal ejection fraction post-stent, so that's a good sign.
Yeah, he had a good result with his stenting. His ejection fraction went back to normal, meaning the heart is pushing out the right amount of blood. It's not weak anymore.
All the stents were placed prior to myocardial injury.
There you go. All right, any questions from our audience? Shot?
No questions.
Shot? Next, we're fixing L4-S1, the bottom disc. Shot? We're going to use the same incision. We're not making any more incisions. Everything is done with this one little incision right here. And we are going to put some more numbing medicine just to make him comfortable, make the anesthesiologist comfortable. Shot? Shot? Oh, it just reminds me. I got a call from that guy selling that laser. Actually, yeah, the one you know.
Oh, really?
Yeah, he just texted me. Said he spoke to his partner. Give him a call. I said, call me when you're ready to, you know, make a deal. A fair deal.
To be honest with you, I don't know that gentleman. I know.
It's fine.
I know his friend.
I'm just... You want me to wait? He's kind of wiggling around a little more.
Give him a little more.
I can wait. So, hey, Sanjay, remind me to call that guy on my cell phone. The one who left me a message. Shot?
Copy that.
Is that my latest picture right there?
Give him a little more.
No, he's fine. I mean, I can work with this if you're okay with it.
You got a good heart rate. Look at the heart rate.
I'll just go nice and slow. Hold. Okay. Yeah, that's beautiful. Actually went in pretty easy because the tear is so big at 5-1. Shot. Uh-huh. Uh-huh. Should be good. Perfect. Okay. Looking good. Mm-hmm. We're almost done. Our next patient is another Deuk laser disc repair, lumbar. I think 3 levels or 2 levels? 3 levels. He's from Ireland. Traveled all the way from Ireland to Deuk Spine. And he has back pain and leg weakness on both sides. We're going to, oh, look at the amount of inflammation. Wait, this is crazy. I'm not doing anything right now. Okay, Sanjay, this is the picture right here. The picture of pictures. Okay, I need you to get this picture. Ready? Hold on. Let me get, what?
Just a minute.
What?
Yes, I'm taking a picture.
I'm going to stop the irrigation. Get that, make sure you're recording. You got it?
Just a minute.
Take a few pictures. I mean, screenshot. You know what I mean? This is beautiful. Look at the inflammation. All the red stuff, the pink stuff. Look at the herniation, the blue thing. Please get this picture. It's very important. Look at the fat goblet.
Taken.
Little droplet of fat. You got it?
Taken. Yes.
Oh my gosh, that's gorgeous. Get some more.
Red
I can't
zone.
even help myself. Look how beautiful that is.
It's
Guys, the red is the inflammatory tissue. It should be perfectly white. There should be no tear like you're seeing in the middle. And the blue stuff is the herniation that causes all the inflammation. Sanjay, save that for the website, lumbar Deuk laser disc repair, inflammation.
Copy that.
Okay. As a matter of fact, I want to put it on the benefits of Deuk laser disc repair. Remember I just did that section?
Yes.
And there's a section that says inflammation.
Yes.
All right?
Copy that.
Inflammation of the annulus. All right, I want you to put that picture. We need that to go to Mudasim.
Copy that.
All right. And this is really nice. Look at this, how it cleans everything up. The laser does. Send me this video link and send it to Mudasim and say Dr. Deuk wants some still pictures from this video, and you can send him the stills as well, for the benefits of the Deuk laser disc repair lumbar. That's the section I just wrote.
Copy.
Okay, and I think there's 13 or 14 different parts. One of them is, debridement of the inflammatory tissue in the posterior annular tear. That is the picture. You have a few more as well, right?
Yeah.
I want to send those to Mudasim so we can put them in there.
Copy that.
So when people are reading it on that treatment page, they'll see the inflammatory tissue that I'm talking about. And now you can get another picture and show how the inflammatory tissue is gone. Can you take another? Right
Yes,
there?
Yes, doctor.
We cleaned it all up with the laser. So there's a before and after. You can put it side by side. Yes? You got it?
Yes, Dr. Deuk.
All right, thank you. It's going to look nice if you do side by side. People will be able to understand what the laser is doing. I had to come off the pedal so fast I almost fell over. Any questions?
No questions.
All right, CC me on the email.
Copy that.
You understand what we're trying to show here, right?
Yes, Dr. Deuk.
All right, good. And you could clearly see it.
Inflammation tissues before and after the laser.
Yeah. And it belongs in the section on the Deuk laser disc repair lumbar. Lumbar, not cervical, not thoracic, lumbar.
Copy that.
Because I talk about 13 benefits of the DLDR. One of them is, getting rid of the inflammation in the annulus, where the pain comes from. I want to show people that, so they understand it. They're not going to find it anywhere else. Since we discovered it, no one else knows about it. Eventually everybody will know, which is fine. But for now, I want to make sure we get it on our site. We got 5 minutes, doctor. We'll be done. 5 minutes. So Luis, Davis wants to get some Dermabond. Try it out for the DPRs, for the hips, knees. Huh?
I have some.
How do you have some?
Yeah, the small ones.
Huh?
The small ones are cheaper.
Yeah, I know. I looked at the pricing.
Yeah,
I think it's fine to try it,
yeah.
but I want to make sure it's going to work compared to the staple. So go ahead and let him use some Dermabond.
No problem. You want for the hip and what else?
He wants to do for the hip and the knee.
Okay.
He wants to use it Friday for his case.
We have a question from Kane's25 on YouTube.
Sure.
Doctor, did you get a chance to watch Dr. Sangho Lee dictate his own surgery awake?
I did. Yeah. So Kane25 sent me, I can't remember how he communicated to me, but he said, you should go on YouTube and watch Dr. Sangho Lee, who is the founder of Woodidal Hospital in South Korea. He's a neurosurgeon. He's an endoscopic surgeon just like me. He was my teacher that taught me the cervical endoscopic technique. Anyway, he had a disc herniation, I guess, and he was awake, and he had his surgeons there operate on his back. And so the YouTube video shows him under the sheets, awake, while they're doing the surgery.
How was he doing with it?
He was telling them, make sure you get over there and cut over there and get that.
Serious? He was directing the surgery.
Yeah, he was directing the surgery. It's pretty funny.
Another reason they call it a theater.
Yeah, it is theatrical. Of course, he's had, fentanyl on board and
Right.
lots of painkillers, but they did a good job, and it's entertaining.
It's one word, in my opinion.
Yeah, there's really no reason for people to be that awake during their surgery. I'm not sure why Dr. Sangho Lee doesn't have more confidence in his staff. I mean, if you think about it, if I was having my number two, or I should say my number one, number two, I don't know what you call it. If I was having my top surgeon operate on my back, I would want to be asleep because I wouldn't let them operate on my back unless I trusted them to do a good job themselves.
Oh, I would knock you out, man.
Right? I mean, why do you need to be awake? Are your people not trained well enough? I mean, I'm just saying, right? I like Dr. Sangho Lee. I admire him. He's a great doctor, great man. He's done a lot, pioneered a lot. But why can't you let your surgeon just do his job or her job, right? Why do you need to be awake telling them what to do?
He might be one of those controlling guys that tells the maid how to clean the house, too.
Well, I just think it's drama. He wants, the wow factor, which is fine, I get it. We're not the first to do awake surgery, right? Awake surgery has been done for many, many years. Hell, the dentists were probably the first ones to do it, But the point is, yeah, I saw it, Kane's 25. It was pretty good. All right, I need 30 seconds left. What Dr. Sangho Lee should have done was come to Deuk Spine to get his back fixed. If he wanted to get the best. All right. A little bit of fat there popping out. How's he doing? Good?
Doing fantastic.
All right.
Great. We're coming in the home stretch. Anesthetics turned off. Ready to roll.
Yeah, he's done a great job for a 86 years old, our patient. Sorry, 87 yesterday, his birthday. So he just had his birthday and he's celebrating it with Deuk Spine. Getting his
Just turned 92.
getting his back fixed. The nerve is right there. You guys see the white thing right there? That is the dorsal root ganglia of the right L5 nerve root. Looks great. We're all done. Yeah, I saw him, Dr. Sangho Lee, walking out of the operating room. Yeah, with that woman right behind him. Pretty cool. Cool stuff. Heavily edited, though. I'm sure you recognize that. We don't edit our stuff. Our stuff is real. Unedited.
No Godzilla movie.
All right, all done. Let me show you the incision. You guys see this right here? We literally lost about, I don't know, 2 cc's of blood. That was it. You guys see that?
Yes, we do.
Okay. His surgery went perfect, and we know both discs were causing pain. One was a 10 out of 10, the other a 9 out of 10, right?
Yes, sir. He did very well.
And everybody did a great job. We got one more to go. Our next patient will be a L4-S1 or L2-33445. One or the other. I think it's an L2-33445. And our last patient for today we have to postpone because that patient apparently had to go to the hospital with a bladder infection or kidney infection. Something's going on. So, am I doing that?
Oh, that's
All right, you can go ahead and end the live stream.